Assalamu alaikum everyone, this is Noraksa and I am a coordinator of Lahore Institute of Medical and Emerging Sciences. The purpose of this webinar is to tell you people about the awareness of doing a paper on meta-analysis, as a running cost of doing paper on meta-analysis is nothing. So the main objectives are: what is systematic review, what is meta-analysis, what is the PRISMA and Prospero. These are two softwares which help us in doing a meta-analysis, and then we will focus on our major software ReviewManager, through which we apply statistical analysis. The major difference between systematic review and meta-analysis is that systematic review answers the defined research question by collecting and summarizing all empirical evidence that meets a set of pre-specified criteria. We collect all the possible studies related to a given topic and design and review and then analyze its results. We do not apply statistical analysis in a systematic review. If we will apply a statistical analysis on a systematic review, it will become meta-analysis. So every meta-analysis is a systematic review, but every systematic review is not a meta-analysis. In a meta-analysis, we basically process the use of statistical methods to combine the results of different studies, and the aim is to integrate the findings, pool the data, and then identify the overall trend of the results. Prisma is the first software. It is basically a website which we use to form a flowchart diagram, and Prisma reporting items for systematic review and meta-analysis. It is basically an evidence-based minimum set of items for reporting in systematic review and meta-analysis. Actually, जो हम फ्लो चार्ट खुद बनाते हैं during meta-analysis different studies के data को combine करके, Prisma basically give us a template of that flow chart, and it focus on the reporting of reviews, evaluating the effects of intervention. The main goals of PRISMA are to ensure a transparent and complete report, assess the positive and negatives of the studies, and then you get a flow diagram out of it. The PRISMA flow diagrams visually summarize the screening process, and it initially records the number of articles found and then make the selection process transparent by reporting on decisions made at various stages of the systematic review, like which studies you are going to exclude and which studies you are going to include, etc. And the number of articles are recorded at the different stages. When you visit the website of Prisma, this is how it looks like, and you download the flow diagram according to your review and demand. I'll later tell you through a tutorial how this works. This is how a Prisma flow diagram looks like. It starts with the total number of studies, and then with each step you screen those records. You exclude some studies, you include only full articles, and review articles are excluded. Moving towards Prospero, which is an international database of prospectively registered systematic reviews where there is a health related outcome. So basically on Prospero आप अपना मेटा एनालिसिस जो है वो रजिस्टर करते हो, और आप ये भी देख सकते हो कि इस टॉपिक पे पहले मेटा एनालिसिस हुआ है या नहीं हुआ. So it provides a comprehensive listing of systematic reviews registered at inception to help avoid duplication and reduce the opportunity for reporting bias by enabling the comparison of completed review with what was planned in the protocol. The Prospero website. Later on, I will tell you how the Prospero works. So basically, you add a rough title and it will tell you either any meta-analysis has been done in the past or is ongoing on this topic or not. And why we use Prospero, it tells us how to search databases, what type of studies should be included, like case control studies exclude कर देते हैं, and how to design your review question. Similarly, it is not on the other side, it is not necessary that you must have to register your meta-analysis on Prospero or not. You can also not register it. For meta-analysis, your data should be of such type that you can calculate odd ratios and confidence intervals out of it. And according to the inclusion and exclusion criteria, only research questions and articles should be included. There should be no review articles, no duplicate studies, no novel allele studies, and also bias studies should not be included in the meta-analysis. You can we can use the Newcastle Ottawa scale to check the biased studies. The score less than 5 indicates the studies are biased, but if score is more than 5, your study or that reported study is not biased. And we can also check if our included studies are heterogeneous or not. If heterogeneity is above 50, then random effect model is selected, and when it is below 50, fixed effect model is selected. And random effect model analyze every study differently, whereas find effect model analyze every study equally. And we can also perform subgroup analysis if there is any. So let me tell you how PRISMA and Prospero works. This is a small tutorial of PRISMA and Prospero. So let's start with PRISMA. You will Google PRISMA, and there are multiple websites with this name, so please write PRISMA flow diagram with it. And this is a site which is for flow diagrams. There are 4 different options, and you can choose the option which suits you the best. I'll choose 2 and will show you how the flow diagram looks like. This is the second one. And as you can see that this is a very extensive flow diagram. The good thing about Prisma is that you don't have to draw these boxes and arrows to make a flow diagram, and your sequence will also not disturb with this. Let me show you a simpler one. Now this flow chart diagram is a simpler flow chart diagram, and you will add your whole articles. Then with each extraction you will tell which articles you are going to exclude, and at the end you will get the number of the studies which are going to be added in your meta-analysis. This is Prisma, and it is very simple to use it. Now let's have a look at Prospero. As I told you people earlier that Prospero is to find out that is any other meta-analysis on the same topic is happening or not. So Prospero tells you that whether anyone else around the world has worked on the same meta-analysis earlier or not, and you can also register your meta-analysis before going to start it on Prospero, so that other people may know that meta-analysis on this topic is happening across the world. So here you register your review or meta-analysis, and here you search about any meta-analysis or systematic review. So let me tell you, I am going to search meta-analysis on Shigella. When I went for this search, Prospero told me that no meta-analysis has been taken place on this topic earlier, but you should try with different words. You can use different keywords. You can also add your title name as it is. Like when I searched with Shigella, I got a whole list of all the meta-analysis which are happening across the world. अब आप देखें कि रिव्यू स्टेटस में उन्होंने बताया हुआ कि दिस मेटा एनालिसिस इज़ ऑन गोइंग, इट इज़ नॉट पब्लिश येट, एंड द वन विच आर पब्लिश्ड ऑलरेडी here review completed published is written in the review status. So it is always better that you try different keywords of your topic to look for this search. Thank you so much. Now Kiran will discuss with you a published paper.
Assalamu alaikum. I am Kiran Nazir. I am going to present a meta-analysis as an example. The title of this meta-analysis is The Effect of Vitamin D Supplementation on Polycystic Ovary Syndrome, a meta-analysis. This article has been published in 2019 in the Journal of Experimental and Therapeutic Medicines. As you know, the polycystic ovary syndrome is a very common hormonal disorder in women. Literature revealed the polycystic ovarian syndrome in adult women is associated with malnutrition, and vitamin D deficiency is one of the malnutrition that is considered responsible for metabolic and hormonal abnormalities in PCOS patients. Before writing any meta-analysis, authors have to recognize the problem exists in the environment and then develop the research question. Similarly, in this meta-analysis, author recognize the problem. We cannot conclude the effect of vitamin D supplementation on PCOS because very few number of studies are demonstrating the effect of vitamin D supplementation, and also these few studies have performed on small sample size. Therefore, this available data is not sufficient to provide the convincing evidence on the effect of vitamin D on PCOS symptoms. Therefore, in this meta-analysis, the research question is whether the intake of vitamin D by PCOS women improves the metabolic and hormonal symptoms or not. Now I will explain the methodology used in this meta-analysis. The first step is the literature search. Only the randomized controlled trials that have published between 1965 to 2019 were selected, and different electronic databases have been used by author that were the PubMed, Embase, Web of Science, and Ovid Medline. Specific keywords related to research questions were used, such as polycystic ovary syndrome, polycystic ovary disease, PCOS, calcitriol, and vitamin D. Next is the second important step for meta-analysis writing, that is the selection criteria. In this meta-analysis, randomized controlled trials and that strictly following the diagnostic criteria of PCOS were selected, and the studies that were reporting other diseases such as hypothyroidism, Cushing disease, and other hormonal diseases were excluded from the analysis. This flow diagram is made by PRISMA software, and it is representing the total number of studies that were collected, then the studies excluded, and finally the studies that were included in the meta-analysis. After selection of specific number of studies, the data was extracted from each article. For example, in this table, you are saying the major characteristics measured in the current study are given. And the first column of author and year, RCT is the abbreviation of randomized controlled trial. And next is the date of accrual, region, patients, age, symptoms, treatment, course, outcomes, and references. Next, the statistical analysis is performed of all of this data. All the data was statistically analyzed by ReviewManager software. Means, standard deviation, and weight mean difference were calculated of each research studies included in the analysis. Then Cochrane test was applied to find the heterogeneity value and significance level. And the forest plot was used to evaluate the effects of treatment. In this table, you can see the mean difference and with standard deviation of both experimental and control group has been calculated, and then weight mean difference is calculated. Heterogeneity value is not significant, but the fixed effect model also representing the BMI is not different between both two groups. You can see here the main lines of each studies. The main points of each studies are lying on the line of null effect. The mean and standard value of both experimental and control groups has been calculated. Weighted mean difference provides the difference between effects on intervention and control. Heterogeneity is actually the diverseness. In this table, its value is not significant, thus indicating no BMI difference between experimental and control group. In the next slide, you can also see the forest plot where all value lie on the line of null effect because there is no, the total testosterone level are not varying between the experimental and control group. Next, same results for DHEA values. The heterogeneity value also not significant and the fixed effect model showing no difference between control and experimental group. Now, the insulin resistance. For insulin resistance, fixed effect model indicating the low insulin resistance in vitamin D treating group as compared to control group. And here you can see in the forest plot, the points are indicating they are favor the experimental group. Now, forest plot of fixed effect model for cholesterol value indicating the treatment favors the experimental group. Heterogeneity value is again not significant. Same is here for LDL and triglyceride and HDL values. Here, the heterogeneity value is not significant, but the forest plot is indicating the treatment of vitamin D is favors the is improving the symptoms or by lowering the HDLC, LDLC, and triglycerides. Thank you so much. This is all about my side.
Now Sarah Nahil will give you a tutorial on Review Manager. So let's hear from Sarah now.
Assalamu alaikum. I'm Sarah Menahil and I'm here for the demonstration of Review Manager. So first of all, we will discuss what is Review Manager. Review Manager is a freely available software from the Cochrane collaboration for the presentation of data. It facilitates preparation of protocols and full reviews, including text, characteristics of studies, comparison tables, and study data. Review Manager helps in the creation of meta-analysis, forest plots, risk of bias tables, and other systematic review elements. Before using Review Manager, our flow diagram should be completed and our data should be completely extracted. The meta-analysis topic on which I'm gonna give demonstration is association of biofilm formation with OMPA gene in ventriculoperitoneal shunt infections caused by Acinetobacter pneumoniae. This is how I have extracted the data. And now I'm gonna statistically analyze this data by using Review Manager. So let's start. इसे हम क्लोज कर देंगे, यहाँ से न्यू फाइल ओपन करेंगे. नेक्स्ट हम इंटरवेंशन रिव्यू के साथ ही जाएंगे. नेक्स्ट यहाँ पे हम अपना टाइटल लिख देंगे। फुल रिव्यू, फिनिश। यहाँ पे हम टाइटल, रिव्यू इंफॉर्मेशन, मेन टेक्स्ट भी ऐड कर सकते हैं, पर ये सब नेसेसरी नहीं है, तो हम डायरेक्ट स्टडीज एंड रेफरेंसेस पे जाएंगे। यहाँ पे हमें स्टडीज इंक्लूड करनी है, तो इंक्लूडेड स्टडीज पे राइट क्लिक करेंगे, ऐड स्टडी करेंगे और वन बाय वन अपनी स्टडीज ऐड कर देंगे, जैसा कि हम एक्सेल शीट पे अरेंज कर चुके हैं। Next. यहाँ पे हम आइडेंटिफायर्स भी ऐड कर सकते हैं, पर वो नेसेसरी नहीं है। Add in the study in the same section, continue. Next. Finish. नेक्स्ट हम डाटा एनालिसिस पे जाएंगे, राइट क्लिक करेंगे, ऐड कंपैरिजन करेंगे। यहाँ पे हम अपना टाइटल लिख सकते हैं या जो भी कंपैरिजन हम कर रहे हैं। नेक्स्ट, ऐड एन आउटकम अंडर न्यू कंपैरिजन, कंटिन्यू। यहाँ पे हम डाइकोटोमिस के साथ ही जाएंगे। वैसे हम यहाँ से अपना डाटा टाइप के अकॉर्डिंग कोई भी ऑप्शन सिलेक्ट कर सकते हैं। नेक्स्ट, यहाँ पे हम अपना आउटकम का टाइटल लिख देंगे। नेक्स्ट, हम यहाँ पे बाय डिफॉल्ट सेटिंग के साथ ही जाएंगे। वैसे मेंटल के साथ हम जाएंगे बिकॉज वो एक्सपोजर ट्रीटमेंट ग्रुप के लिए यूज़ होती हैं और हमारी स्टडी भी उसी में फॉल करती हैं। edit the new outcome and finish. यहाँ से हम अपनी स्टडीज को ऐड करेंगे। और यहाँ पे हम अपना डाटा एंटर करेंगे मैन्युअली, जैसा कि हम अपनी एक्सेल शीट में एंटर कर चुके हैं। जब हम अपना सब डाटा एंटर कर लेंगे तो यहाँ से हमारे पास फॉरेस्ट प्लॉट बन जाएगा। फॉरेस्ट प्लॉट में हर स्टडी के सामने एक हॉरिजॉन्टल लाइन होती है, विच इज बेसिकली 95% कॉन्फिडेंस इंटरवल। और ये जो ब्लू स्क्वेयर बॉक्सेस हैं, ये हर स्टडी का इंडिविजुअल इफेक्ट शो कर रहा है। The size of these boxes is directly proportional to their weight in the analysis. और जो हमारे पास एंड पे डायमंड बनता है वो ओवरऑल इफेक्ट को शो करता है हमारी स्टडीज का। जब ये डायमंड अगर वर्टिकल लाइन के मिडिल में हो तो इसका मतलब होता है कि हमारा डाटा स्टैटिस्टिकली सिग्निफिकेंट नहीं है। इसके बहुत से रीजंस हो सकते हैं। फॉर एग्जांपल डिफरेंट एथनिक ग्रुप्स इन्वॉल्व है हमारी एनालिसिस में। ये वर्टिकल लाइन इज बेसिकली नॉन एज लाइन ऑफ नो इफेक्ट, मतलब ये लाइन कोई भी इफेक्ट शो नहीं करती। इस फॉरेस्ट प्लॉट को हम कहीं पे भी अपने जहाँ पे हम पेस्ट करना चाहें यहाँ से हम कॉपी करके पेस्ट कर सकते हैं। और यहाँ से हमारा फनल प्लॉट बन जाता है। फनल प्लॉट बेसिकली बायसनेस को चेक करने के लिए है। अगर स्टडीज हमारी फनल शेप में आए तो इसका मतलब होता है कि हमारी स्टडीज बाइस नहीं है। और अगर फनल शेप ना बने तो इसका मतलब होता है कि हमारी स्टडीज बाइस्ड है। सो दैट्स ऑल, थैंक यू।
So thank you so much everybody for such a wonderful presentation and for such a guidance to everybody. The meta-analysis and the systematic review can be done by any PhD scholar, any MPhil student, even the BA students which are in their last semesters can also try to do this. The purpose of conducting this webinar is to tell you people that it is not as much difficult to perform meta-analysis as we think. सो आप थोड़ी सी प्रैक्टिस करें, आप एक अच्छा स्टैटिस्टिकल एनालिसिस कर सकते हैं और किसी भी जर्नल में एक अच्छा पेपर पब्लिश कर सकते हैं। यू डोंट नीड टू परफॉर्म एनी लैब एक्सपेरिमेंट, यू डोंट हैव टू परचेज एनीथिंग टू परफॉर्म मेटा एनालिसिस। सिंपल आपने रिसर्च करनी है अपने डाटा की और आप किसी भी टूल को यूज़ करते हुए, वो चाहे वो रिव्यू मैनेजर हो, वो स्टाटा हो, आप एनालिसिस कर सकते हैं और आपका पेपर बहुत जल्दी एक्चुअली मेटा एनालिसिस का पेपर पब्लिश होता है। पाकिस्तान में तो वैसे ही स्टडीज़ जो हैं वो बहुत कम हुई हैं। लेट मी शो यू द 4 पेपर्स which have been published in very good journal which have high impact factors। इसमें से जो सिस्टमेटिक सर्वेलेंस वाला पेपर है दैट हैज़ बीन पब्लिश्ड इन जर्नल ऑफ ग्लोबल एंटीमाइक्रोबियल रेजिस्टेंस बाय अ PhD स्कॉलर ऑफ आवर टीम, और ये पेपर विदाउट एनी रिवीजन के एक्सेप्ट हो गया था। सो यू हैव टू पुट सम एफर्ट और आपका पेपर जो है वो ईज़िली पब्लिश हो जाएगा। if any one of you have any question you can ask and contact us at any time। the last thing which I want to add that इनमें से कुछ पेपर्स में स्टाटा यूज़ हुआ है, कुछ में एक डिफरेंट सॉफ्टवेयर भी यूज़ हुआ है। आप इन पेपर्स को डिटेल में देखें और अपनी नॉलेज को इम्प्रूव करें। और हमने रिव्यू मैनेजर पे ये वर्कशॉप इसलिए कराई है क्योंकि रिव्यू मैनेजर कंपैरेटिवली इजीली है एज़ कम्पेयर टू स्टाटा। सो thank you so much again, and for any question contact us at this email।